Hi friends, good evening and welcome back to my channel Mukambika Nursing. Friends, here in this video we can see the questions from Community Health Nursing. Yesterday's video we discussed first set of questions from Community Health Nursing, and today again we can see the continuous questions from Community Health Nursing. We can see the question one by one. Question number 16. The voluntary health agency whose main objective is to improve the condition of women is. Options are option A Red Cross Society, option B Kasturba Memorial Fund, and option C TB Association, and option D Family Planning Association of India. Here the correct answer is option B Kasturba Memorial Fund. Okay, here Kasturba Memorial Fund means this is an voluntary health agencies in India, and this Kasturba Memorial Fund is established in the year 1944. And the main objective or the main function of this Kasturba Memorial Fund is to improve the condition of women, especially in villages, through Grama Sevagas. Okay, so here question is the voluntary health agency whose main objective is to improve the condition of women is. Correct answer is option B Kasturba Memorial Fund. Question number 17. The vaccine which leaves permanent scar in babies. And options are option A DPT, option B BCG, and option C hepatitis, option D polio vaccine. Here the correct answer for this question is option B BCG is the correct answer. The BCG vaccine which leaves permanent scar in babies, and this BCG vaccine is usually given in the left upper arm, and this BCG vaccine is an example of live vaccine. That is an important point. BCG vaccine is a live vaccine. Question number 18. Which among the following is the most important treatment of a patient with dengue hemorrhagic fever? And options are option A apply ice pack over the abdomen to prevent melena, option B replace body fluid, option C provide antipyretics, and option D provide aspirin for fever. Here the correct answer is replace body fluid. In this question we have to focus the question properly. Here question is most important treatment of a patient with dengue hemorrhagic fever. Already the patient is hemorrhagic, that is bleeding is occurs for the patient. So most important care. Ice pack means it is not necessary for a bleeding patient. Provide antipyretics, it is for fever. Aspirin, provide aspirin for fever. Aspirin means it's an anticoagulant, so we should not give to this bleeding patient. Okay, again it will cause bleeding. So what is the most important treatment is replace body fluid. Blood is going to from the patient. Okay, hemorrhage, through hemorrhage blood loss is occurs from the patient. So appropriate answer is option B. Question number 19. Immunization is an example of which level of prevention? And options are option A primary prevention, option B secondary prevention, option C tertiary prevention, and option D primordial prevention. Here correct answer is option A primary prevention. The levels of prevention include primordial prevention, primary prevention, secondary prevention, and tertiary prevention. Here the primary preventive measures include general health promotion and specific protection. This general health promotion means we are improving the health standards through health education, food fortification, lifestyle and behavioral changes, and environmental modification. That is general health promotion. And specific protection methods. Specific protection means that is for particular disease and all we are giving protection, that is vaccination is an example of vaccination, or immunization is an example of this specific protection methods. And also vitamin A and iron, folic acid supplementation, and use of condom to prevent HIV and AIDS. These are all specific protection methods. Here our question is immunization. Immunization is an example of primary prevention. Okay, option A is the correct answer. And the next question, Question number 20. Which one of the health service is not available in a rural health unit? And options are option A maternal and child health work, option B communicable disease control work, option C environmental sanitation work, and option D cancer treatment facility. Here, correct answer for this question is option D. Cancer treatment facility is not available in a rural health unit. Okay, remaining options, that is maternal and child health work, communicable disease control measures, environmental sanitation measures. These are all the part of rural health services, but cancer treatment facility is not a part of or not available in rural health unit. Question number 21. A child with pertussis should be isolated for. Options are option A 1 to 3 weeks, option B 1 week, option C 3 to 4 week, and option D 2 to 4 week. Okay, here correct answer for this question is option A 1 to 3 weeks. Here our question is child with pertussis should be isolated for. Okay, isolation is an example of secondary prevention method. So in this question pertussis means whooping cough is another name is whooping cough, and the causative organism of this pertussis is Bordetella pertussis. Here question is isolation. Okay, once in this case once the cough occurred to the child, from that day to 1 week to 3 weeks the child should be isolated. Okay, so from the beginning of the cough is noted that from that to 1 week to 3 weeks the child should be isolated. Here 1 to 3 weeks is there. Suppose in our option 2 to 3 weeks means that is also correct. Here 1 to 3 weeks is there, so that is correct. Question number 22. Influenza A vaccine was started in. Options are option A 2004, option B 2005, option C 2009, and option D 2010. Here correct answer for this question is option C 2009 is the correct answer. The influenza A vaccine was approved in the year 2009, and this vaccination begins by October 2009. That is also important point. Question number 23. The vaccine for meningococcal meningitis provide immunity which lasts for about, and options are option A 1 year, option B 2 year, option C 3 year, option D 4 year. And the correct answer for this question is option C 3 year. This meningococcal meningitis vaccine mainly given to prevent meningococcal infections. Okay, and the immunity which is get from this vaccine is last up to 3 years. And this vaccine is an example of conjugated vaccine, and the dose for this vaccine is 0.5 ml, and the route of this vaccine is IM, either IM or subcutaneous. This is also important points. Here answer for in our question is option C 3 years. And the next question is question number 24. Diseases which are transmitted by water and food are called. Options are option A vector-borne, option B vehicle-borne, option C airborne, and option D fomite-borne. Here correct answer for this question is option B vehicle-borne. Vehicle-borne diseases is one of the indirect transmission diseases such as food, air, water, blood, and fomite-borne. All are example of this vehicle-borne. So here our question is the diseases which is transmitted by water and food are called vehicle-borne. Question number 25. Tuberculosis is predominantly spread by, and options are option A fomite, option B droplet, option C food, option D vector. And the correct answer for this question is option B droplet is the correct answer. Tuberculosis is a spread through by droplet infection. And our first option fomite borne infections mainly occurs through the articles. Okay, articles that convey infections are known as fomite-borne infection. Mainly it is spreading through the hospital instruments, articles, dressing instruments. Such infections are known as fomite-borne infections. Here our question is tuberculosis is spread by droplet infection. Option B is the correct answer. Okay, so this question was asked in previous question paper also. So study all the questions thoroughly for exam.